There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, are people really serious about curing themselves of hypertension, high blood pressure? Answer by Sashu. What is blood pressure? When the heart beats, it pumps out blood around the body to give appropriate oxygen and energy it requires. When the blood moves, it pushes against the blood vessels, and this strength is called blood pressure. If the blood pumped by the heart is in a large amount and if the artery is narrow, then your blood pressure will be higher. Symptoms of high blood pressure. People with high blood pressure may experience headaches, nosebleeds, or shortness of the breath. However, other major signs include fatigue, pain in the heart, difficulty while breathing, dizziness, frequent urination, palpitations, nervous tension. Note, these symptoms do not affect specifically until the pressure of the blood increases severely to that of a life-threatening stage. Natural remedies for high blood pressure. Triphala. Triphala is one of the best herbal blends used in Ayurveda. For people who are unaware of Ayurveda, it is the world's oldest holistic healing systems, which originates from India. This sophisticated therapy can treat various illnesses. Hence, hypertension is no exception. Triphala has 3 herbs: Haritaki, Terminalia chibula, Bibhitaki, Terminalia bellica, and Amla, Emblica officinalis, which are first dried and then ground into fine powder. According to Ayurveda, Triphala delivers multiple health benefits. It lowers high blood pressure, improves digestion, rejuvenates the body, reduces cholesterol, and most importantly, decreases atherosclerosis, deposition of fats on the inner walls, in the arteries. Follow the below steps to try a remedy using Triphala. Step 1. Buy Triphala from the link given above or an herbal store near you. Step 2. Consume 5 grams of this powder every night before bed with a glass of warm water. Step 3. Do not eat anything for 1 hour after consuming Triphala powder. Note, avoid fasting, salty and spicy foods when using this remedy. How does this work? Triphala has plenty of vitamin C and antioxidants. It contains linoleic acid and phospholipids, which are well known to lower blood pressure. Its capillary and cardiotonic strengthening flavonoids improve circulation. It increases the adrenergic function and helps the body to relieve stress, an important cause for hypertension. Also, Triphala has anti-obesity effects and anti-inflammatory properties, which helps in decreasing edema. By reducing edema, there is a less pressure against the walls of blood vessels, thus decreasing your high blood pressure. Triphala is not good if you suffer from gastrointestinal discomforts. You have frequent gas or acidity problems. You have diarrhea. You are pregnant or breastfeeding. Drumstick or moringa leaves. According to Ayurveda, the leaves of drumstick can cure about 300 diseases, while the one being high blood pressure. It has approximately 46 antioxidants and 90 essential nutrients. They fight against bone, eyes, nerves, and heart-related problems. You can consume drumstick leaves in different ways. Here are a few methods for you to try. Method 1. Step 1. Wash fresh drumstick leaves and boil with water for 5 to 8 minutes. Step 2. Strain the liquid and drink it once warm. Method 2. Step 1. Take a pan and pour 1 teaspoon of vegetable oil into it. Step 2. Once the oil heats, add 12 teaspoon mustard seeds, 1 dried red chili, and 12 teaspoon split black gram. Wait for the mustard seeds to splutter and split black gram to turn slightly brown. Step 3. Add a cup of chopped onions. Fry until they turn golden brown. Add few curry leaves into it. Step 4. Clean the fresh drumstick leaves with water and add them to the pan. Step 5. Sauté, medium heat, until the moisture escapes. Step 6. When there is no more water in the pan, add 1 tablespoon freshly grated coconut. Step 7. Eat with a cup of brown rice for best results. Method 3. Step 1. Take 1 ounce of fresh drumstick leaves and clean it thoroughly. Step 2. Mix 1 teaspoon of fresh garlic juice to it. Step 3. Drink early morning on empty stomach. Do not consume anything for the next 30 minutes. How does this work? Drumstick or moringa leaves are claimed to be highly effective against high blood pressure when consumed early morning in empty stomach. Also, chewing the leaves have proven to be very helpful in pre-hypertensive patients. They are highly rich in iron, antioxidants, magnesium, riboflavin and vitamin C. Despite of so many natural minerals and nutrients, these dark-colored leaves contain a magical antioxidant called quercetin, which helps to lower high blood pressure. Drumstick is not good if You are pregnant, can cause a miscarriage, or breastfeeding. You consume its roots. They contain an alkaloid called spirochin, which happens to be a neuroparalytic toxin. It can cause paralysis and even death. You suffer from heartburns. Chewing them raw can worsen the condition. It is better to cook before you eat it. You are taking medicines for blood thinning. You have gum bleeding. 13. Banana. Did you know that consuming 2 bananas a day could lower your blood pressure by 10%? Since they constitute high levels of potassium, they are proven helpful for hypertension. In fact, an everyday intake of 5 bananas equals 2,300 milligrams of potassium, might lower blood pressure by half as much as medicines or drugs can. How does this work? Bananas are effective in regulating and controlling the blood pressure. They contain a higher quantity of potassium, which reduces the effect of sodium. So, you need to have 1 or 2 bananas daily. Also, add few other foods in your daily diet: dried raisins, apricots, currants, zucchini, winter squash, cantaloupe, spinach and baked sweet potatoes. Bananas are not good if you are diabetic. Bananas might alter blood sugar levels. You have a history of IBS, irritable bowel syndrome. You may suffer from diarrhea, bloating and stomach pain. To know more at-home remedies for high blood pressure, hypertension. Answer by Ruben Fogg. Hello Rajinder Bala. Agree with you. People have a mentality that they are suffering with high blood pressure just because of aging, but nowadays it's not about your age or unhealthy diet, junk food, office timing. No walk is some of the main reason of hypertension. Blood pressure can be seen as a barometer of overall circulatory health. Someone with high blood pressure is at a significantly greater risk for heart failure, stroke, chronic kidney disease and damage to the arteries, similar to the damage caused by high cholesterol, which can cause heart attacks. It's no different for those reaching their senior years. While nearly 1 in 3 Americans suffers from hypertension, as high blood pressure is often called, blood pressure typically increases with age, especially once one has passed middle age. According to the National Heart, Lung, and Blood Institute, someone with healthy blood pressure at age 50 has a 90% chance of developing hypertension later in life. When a doctor tells you that you are suffering with hypertension, then for some day you control your diet, avoid junk food at all, but after a few days you continue with your daily routine and forget your health. For living a healthy life, keep in mind all things which doctors prescribe you. There are many lifestyle changes you can make to lower your risk of high blood pressure, including: keep a healthy weight. Being overweight adds to your risk of high blood pressure. Ask your doctor if you need to lose weight. Exercise every day. Moderate exercise can lower your risk of high blood pressure. Set some goals for yourself so that you can exercise safely and work your way up to exercising at least 30 minutes a day most days of the week. You should check with your doctor before starting an exercise plan if you have any health problems that are not being treated. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, and low-fat dairy products may help to lower blood pressure. Ask your doctor about following a healthy diet. Cut down on salt. Many Americans eat more salt, sodium, than they need. Most of the salt comes from processed food, for example, soup and baked goods. A low-salt diet might help lower your blood pressure. Talk with your doctor about eating less salt. Drink less alcohol. Drinking alcohol can affect your blood pressure. Most men should not have more than 2 drinks a day. Most women should not have more than 1 drink a day. Don't smoke. Smoking increases your risk for high blood pressure, heart disease, stroke, and other health problems. If you smoke, quit. Get a good night's sleep. Tell your doctor if you've been told you snore or sound like you stop breathing for moments when you sleep. This may be a sign of a problem called sleep apnea. Treating sleep apnea and getting a good night's sleep can help to lower blood pressure.